Hello, hi everyone. Today I would like to discuss about headache. Headache is a very common problem felt by many people. There are so many causes behind headache. Most of the time it is a simple problem, but sometimes it can be serious problem as well. Commonly in medical practice, we come across patients coming with headache due to various reasons. The usual causes responsible for headache, one is migraine, sometimes related to some upper respiratory infections, sinusitis, tension headache, which is produced by mental stress and strain, and sometimes what we call it as cluster headache. These are the common causes for headache. This migraine is very common. A lot of patients come with one-sided headache associated with some nausea-like feeling, cannot tolerate light, cannot tolerate sound, and they want to sleep. And this kind of headache comes under a category called migraine. There are different kinds of migraine as well. Some patients develop some flashes of light coming in front of the eyes before the development of headache, lasting for 10 to 15 minutes. Then they start developing headache. This is called classical migraine or migraine with visual aura. And there are some serious causes for headache also, which includes headache due to problems in the brain like brain tumor, hemorrhage into the brain, due to head injuries. So these are all very serious problems. Brain tumor related headache develops slowly and lasts for several weeks to months, and it produces sometimes intractable vomiting. On examination of the patient, we make out some problems like papilledema inside the eye. The optic disc becomes swollen, which is called papilledema. Sometimes cranial nerve paralysis, and there is a abnormality called extensor plantar response. When we strike at the feet of the patient, normal response is like this, which is called flexor. In patients having abnormalities like this, it may become like this, which is called extensor plantar response. Brain hemorrhage, usually the headache is very fast, like this, sudden onset, which can be due to very high blood pressure resulting in coma even or paralysis. So brain hemorrhage can be into the subarachnoid space or intracerebral hemorrhage. Sometimes the patient develops headache following head injuries. This is because of the development of hematoma inside the brain. It's called subdural hematoma. Sometimes the patient may not even remember their trauma. It may be so trivial, especially in elderly people. So we take all possibilities considered when the patient comes with headache, and we go into a detailed history analysis, examination, and diagnosis based on imaging like X-rays, CT scan, MRI brain, which will provide any serious problems inside the brain. Majority of the patients don't have any serious issues. Mostly the conditions which I mentioned, like migraine, sinus headache, cluster headache, tension headache, like that. Vast majority comes under this category only. If the headache is persisting, then we look for all these problems. Of course, the brain hemorrhage related headache will be always in sudden in onset. It's a medical emergency. So this is a very brief nutshell about the headache.